Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cooper.
How did you decide this is a career path?
Well, it started, I was in college during between 2008 and 2012. The economy was not the greatest in the world. And fortunately, I was at college on a full scholarship. And I sat with my dad one day. I really wanted to be a doctor or work. I don't know. I wanted to work in science. I love science, doctor, scientist, engineer, something like that. And with all those things, usually comes grad school. So I sat with my dad and he's like, look, you got 4 years, so make it count. Started doing a lot of research, and the university I was at had a pretty robust nursing program. And I was like, well, I'll apply to nursing. It's a 4-year degree. I can get out. I can make a decent living. And then nursing affords so many different avenues of, career paths for those who have experience. There's now a big push for legal nurse consultants that work with lawyers to help go through medical information and translate it. There's flight nurses, there's nursing anesthetists, there's nurse practitioners in both primary care, acute care, and psychiatric settings. Nursing consultants, and lots of nurses in business now. So that's how I got into nursing. It was basically just a safe play, a safe bet while I was at college for free. Okay. The school I attended up until my senior year, it was finally closed. We would average anywhere from between 12 and 15 kids per class, and it was a public school.
Wow.
It was a small mill school, and like all mill towns in the early 90s, things started shutting down. So the school finally closed in 2006, I believe.
Oh, terrible.
So yeah, very, very small town. I always make a joke, like the road I grew up on, I think everybody but maybe 3 or 4 people from my entire family all lived on that same road.
Wow. When it comes to that 4-year degree, that's interesting to me because I think a lot of kids, myself included, when I was back in school, I didn't know what the hell I wanted to do with my life. It's a little,
absolutely,
a little ass backwards, right? You're supposed to figure out and pick a major before you really have had an opportunity to experience life or, witness anybody operating in the profession of your chosen career. And so with you, though, what I like about it is you made those 4 years count. And regardless of whether or not you were going to, actively pursue a career in nursing, you had a degree that was worth something. So what did you graduate with? Did you graduate as a registered nurse, as an RN?
Yeah, so the way nursing education works is there's a few different degrees. You can become an LPN, which LPNs, some states call them LVNs, a licensed vocational nurse or a licensed professional nurse. It's a degree that's kind of through very similar like a trade school degree. You go Monday through Friday, 8 hours, and then the kind of the length of the program, due to everything being compact, is a little shorter. And LPNs, LVNs can do most things that are RN registered nurse can. There's just a few things here and there that they're not allowed to do based off of education. They still take the NCLEX. They still have to take boards and remain, licensed professionals. Then you have an ADN degree, which is the associate's degree in nursing. That's usually a 2-year program at a community college, tech school. And then you have the BSN degree, which is the bachelor's in nursing. Since I was already at a 4-year university, that's what was offered. That's, the degree I ended up with.
I did blood work and I spoke to, a medical, who's a nurse practitioner, that, it just kind of started coming together. And I was like, look, man, you gotta cut that
Right.
stuff out. But what
And societally,
go,
with you
yeah.
doing that, but that was you're at home, you're winding down, even though you knew that that was unhealthy and not unhealthy kind of physically and mentally, you could stop. But because societally that's okay, the term functional alcoholic didn't come around because somebody just come up with it. It's, hey, what Ray does in Ray's house is his business,
Yep.
but he works, he um, provides for his family. He's a functional member of society, so nothing's wrong with that.
Hmm. Yeah. And that's a problem because there is something wrong with that for me, right? So
Right.
I was functioning, but was I functioning optimally? Hell no. I was a world away from optimal. But my curiosity though is, what is the difference between someone like me that can kind of flip a switch, and then you hear about folks that go through DTs and shakes, and I didn't have any of
Mhm.
that. Like I didn't, maybe there was a day where I felt a little headachy or something like that. Very, very mild. But there were no heavy, serious withdrawals or anything like that. But there are folks, and I don't know if there's a gauge or a meter for the difference between my alcohol intake and maybe someone that's drinking a bottle a day. Um,
Mhm.
or if it's a combo of that and genetics. What is, just like, what is a comparison between what I experienced and what someone who's really a hardcore alcoholic might go through?
Yeah. Well, I mean, with you having headaches and things, that is some withdrawal symptoms.
Yep.
Um, a lot of times, to bring it into perspective with people, I just use coffee. Most Americans drink coffee.
Hmm.
Most people have to have a cup of coffee to get up in the day, and your body is addicted to caffeine.
Mm.
If you drink soda, coffee, tea, caffeine is an incredibly addictive substance.
Mm.
If you meet that person that they're a 2-3 cup of coffee a day drinker, and they don't have that second cup, or they didn't even have their first cup, they're usually very irritable. Um, they may be complaining, "Hey, I have a headache. I can't focus." Um, just snapping at everyone. That's classic withdrawal symptoms.
Mm.
So what you went through was, withdrawal symptoms on a very mild scale, but yes, there are those people who go through the more life-threatening withdrawals.
Is that
And those people
is that all
usually drink a lot more heavily.
when people say they're hangry?
Yes.
Someone hasn't eaten for a while, and then they're irritable. Same thing, like they're
I mean, it's your body withdrawing. Your body saying, "Hey, I need my pleasure centers filled, and I'm not getting that."
right.
Um, so our biggest push is to treat addiction as any other disease. Um, Something that brings it into a lot of brings it into perspective for a lot of people is, I just compare it to type 2 diabetes. Type 2 diabetes is usually a lifestyle disease, sedentary lifestyle, poor diet, um, and your body just doesn't know how to process it much anymore. However, once you get to a certain point with diabetes, you may have to start taking medication, just by mouth medication, or it may get to the point where you're needing to take, insulin injections. With addiction, it's the same thing. It could have been started out as a lifestyle disease, a coping mechanism, self medicating from some other health condition. But we don't treat it like a disease. The old kind of methadone clinic model is daily dosing. They come in once a day. Usually the hours are between like 5 a.m. to noon. You stand in line, you get your dose for the day, and it's just rinse, wash, repeat. Our model is, you make an appointment like a regular doctor's office. You come in, we, the first appointment, the doctor does a full assessment like your family doctor does, but it's more gauged to what substance were you using? When did you start using it? using it, and what does your use look like now?
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.